Hi there, I'm your host, Connie Tran. Thanks for joining us today for this COVID-19 special. A lot has changed since March 2020, when the first case of the coronavirus was detected in Fresno County. The vaccine against COVID-19 is now available for everyone. That means even children as young as 5 years old can be protected against this deadly virus. We met one local family who shares why it was so important everyone in the family get the shot, including their youngest member, a 7-year-old who was eager to roll up his sleeve. The Santiago family is officially vaccinated against COVID-19. It was a long time coming, says mom Monica Santiago. She and her husband Jermaine got the vaccine in early 2021 and anxiously awaited its approval for children.
It was a no-brainer. They're vaccinated with other vaccines, and if we have to have boosters, then we do it. But at least we have to follow the science and do it.
Monica suffers from chronic asthma and wanted to ensure her family was safe from getting or spreading COVID-19. Her daughter Jaden, who was 13, was eligible to receive the vaccine in July.
She was fine. Me and my husband got reactions. She didn't get one. At all.
We know that the vaccine is about 90% effective, and no one who was vaccinated in the studies ever ended up with serious COVID infection. So we definitely know that this vaccine works.
Dr. Christian Falkenberry Miranda says though the death rate in children who have COVID-19 is significantly less than adults, it's still a virus that can be debilitating to their young bodies.
Kids are getting exposed and being out, so it affects their learning and being able to attend classes. They also are getting something called long haul COVID, which is affecting somewhere around 7 or 8% of our kids. They might have a very minor COVID infection, but they have symptoms that are lasting for months after their infections. They may have unexplained fevers, they'll have joint pains. Many of them are unable to return to their previous activity levels.
That's why in October, when the FDA moved forward with an emergency use authorization for the Pfizer vaccine to be administered to children between 5 and 11 years old, Monica knew it was her son Marcus's turn.
We explained to him, Sissy got a shot and we all got a shot, and this is going to protect us.
We spoke to Marcus just hours after he received his first dose.
It didn't really hurt that much, like not one bit, because if it would have hurt, then I would have started crying, but I didn't, so it didn't hurt at all.
Marcus says he feels extra safe to be at school now, a place he missed when he was forced to stay home during the pandemic.
I get to see my friends and I get to learn more and everything.
Monica says she's relieved her entire family is vaccinated against COVID-19, especially her children.
If we want them to be in school and get back to their normal lives, this really is the route to go. This vaccine is safe.
Dr. Falkenberry Miranda urges all parents to have their children 5 years and older get the vaccine as soon as possible.
Please, please, please get your kids vaccinated if they're eligible. COVID is a very serious illness, even in kids, and kids are at risk.
For more information about COVID-19 vaccines and where you can get yours, visit myturn.ca.gov.